Welcome everyone to this webinar regarding the PAD, Peripheral Artery Disease. We will start by a general presentation of this guide. To do so, we will have Dr. Jean-Pascal Costa, and then we will have Dr. Gabriel Huard, who's going to present in more specifically what is PAD.
So hi everyone, very happy to be with you today for this webinar on peripheral artery disease that we also call the PAD. My name is Jean-Pascal Costa. I'm an internal medicine specialist working at the CHUM Hospital in Montreal. My role today is to present to you our wonderful guide. So after this short presentation, I will let my colleague, Dr. Gabriel Huard, talk to you a bit more about PAD in general. So I'll start by presenting the guide, and then Dr. Huard will go on with a definition of PAD, the symptoms of PAD and the consequences, and we'll have a short period of questions at the end. So before we go on, let me explain the reasons behind this guide. So first of all, we started with the following observation. PAD is an unknown disease by general population. If we compare to other diseases like heart attack, stroke, or breast cancer, PAD is not as advertised. We then identified the need to create information intended for patients and family, as well as for healthcare professionals that take care of these patients. We then consulted an instructional designer to help us with the content and the way to present that content. We also hired a graphic designer who created wonderful illustrations to highlight the content. The next step was to determine the table of content. And then we had to find some authors, specialists in their own fields. We then gave them a challenge. The challenge was for them to use plain language and write a text accessible for all. And I have to say that they were able to rise to the challenge. So here you can see the different themes tackled in the guide. So first of all, we start by giving a definition of the peripheral artery disease. And then we go on by explaining what's happening in your legs. We then give some risk factors related to PAD. And then we explain the diagnostic methods. There's also a chapter on how peripheral artery disease affects your daily life. And there's another chapter on the treatments. And we finish by giving some tools to help the patients and their family to deal with the disease. So here you can see the different authors of the guide. So people coming from different disciplines. For example, we have residents in general internal medicine. We have residents in radiology. We have psychologists. We also have vascular surgeons and residents in vascular surgery. And we also have kinesiotherapists. So the guide is a total of 20 collaborators, people from editors to reviewers. I have to acknowledge donations from Bayer, Canada, and from generous families and Canadian institutions that really help to financing this project. I have to thank Mr. Gabriel Dumochel, our instructional designer, and Christine Saint-Onge, our graphic designer. Speaking of Christine Saint-Onge, here you can admire her amazing graphic work. So here you can see examples of pages of the guide. As you can see, once again, amazing illustrations by Christine Saint-Onge. And this brings me to introduce our good friend, Tim. So Tim is our mascot, our friendly character who takes care of his health and who likes it when the information is short and simple. So this means that if you don't have time to read the entire guide, you just need to find Tim and he will give you a summary of what you need to know on each chapter of the guide. So allow me to join my good friend Tim, and together we wish you happy reading.
Welcome, everyone, to this second presentation on peripheral artery disease of the Canadian Foundation for Vascular Health. I'm Dr. Gabriel Huard, general internist and vascular medicine specialist. Today, we'll talk about PAD definition, PAD symptoms, and risk factors. To understand what is peripheral artery disease, we need to know more about the cardiovascular system. Our organs, such as the heart, kidneys, and muscles, need oxygen to work. And oxygen is transported through our bodies by the vessels of our blood system. These vessels are the veins and the arteries. As you can see in that figure, the blood passes through the lungs to capture the oxygen, and oxygen-rich blood then goes through the heart, which acts like a pump and send it to all of our organs. Arteries are the vessels that carry the blood from the heart to the organs. And as you can see here, arteries are usually red in a figure of the cardiovascular system. The other vessels are the veins. They bring back the blood from the organs to the heart, and they are usually in blue. Peripheral arteries include all arteries outside the heart, but when we talk about PAD, we usually exclude vessels of the brain and the heart. So it's almost all of the arteries of our bodies. Finally, PAD most often affect the artery of the limbs. That's why we usually talk about the artery of the limbs when we use the term PAD. Today we will talk more about this disease that may affect your legs. Peripheral artery disease is when those arteries are sick. Many factors can contribute to the vascular damage. We'll talk more about these risk factors in a couple of minutes. The arterial sclerosis, like the high cholesterol, is the more frequent cause of PAD. Cholesterol accumulates in the arteries and then creates cholesterol plaques. Those become stiffer, and with time, as they grow, the size of the affected vessels decrease, as you can see in the figure on the left. So the cholesterol plaque block the blood circulation. Symptoms appear when the artery narrowing is very severe. Cholesterol plaques usually takes years to become symptomatic. However, a plaque may rupture and cause a clot that completely block the artery, as you can see on the figure on your right. It's like a heart attack, but in a limb. 20 to 50% of patients don't have any symptoms when the diagnosis of PAD is made by a physician. We can find cholesterol plaque on radiology exam, or abnormally low cuff blood pressure, for an example. We'll discuss the diagnostic test for PAD in another presentation. However, no symptom doesn't mean that there is no consequence on your health. Asymptomatic PAD increases the risk of heart and brain disease. Atherosclerotic is a systemic disease. If there is a disease somewhere in your limbs, it's probably affecting other vessels as well, like those in your heart and in your brain. So the patient with PAD are at high risk of heart attack and stroke. After 5 years of the diagnosis of PAD, about 20% of patients will develop these complications. Moreover, about 10 to 15% of patients will decease in the next 5 years of the diagnosis, usually from cardiovascular disease, as you can see here. In terms of mortality, we talk about 7% of people affected by PAD who die in 2015. Is it the twice rate of death of people with heart disease? That's the reason that we need to be very aggressive with cardiovascular risk factor reduction in people with PAD. We'll talk about the risk factor management in another presentation. Now, let's talk about PAD symptoms. Cough pain is the cardinal symptoms of PAD. It appears when you walk, and it disappear at rest in less than 10 minutes. We call it vascular claudication. We use the Edinburgh questionnaire to evaluate patients, as you can see here. So you have to answer yes to all of those questions to have a diagnosis of vascular claudication. So the question are, do you feel pain or discomfort in the legs when walking? Does the pain ever begin when you are standing or sitting? Do you get it if you walk uphill or hurry? Does it disappear within 10 minutes when you stand still? And the last one, do you feel the pain in your calf, thigh, or buttocks? At the end, if your pain is in the calves, you have defined vascular claudication. And if your pain are in the thigh or the buttocks, you have atypical claudication. If you answer no to one of those questions, you usually don't have symptomatic PAD. And about 10 to 35% of patients with symptomatic PAD have the defined claudication, and about 30 to 40% have atypical claudication. An interesting point about the PAD is that the majority of people with a diagnosis of vascular claudication will have a good outcome from the PAD point of view. In fact, the symptoms will be stable or improve in 70 to 80% of patients. However, 10 to 20% of patients will deteriorate, and 5 to 10% will develop critical ischemia that may cause gangrene or amputation. Now we'll talk about the risk factors for PAD. Risk factors is any characteristic or exposure of a person which increase the likelihood of developing a disease. Risk factor may be modifiable, one we can take action against, or non-modifiable, meaning when we cannot take action against them. As you can see in this figures, modifiable factors for PAD are diabetes, high cholesterol, high blood pressure, obesity, sedentary lifestyle, physical inactivity, stress, current smoking, and diet. And non-modifiable factors are the age, the ethnicity, the genetics, and the sex. So it's the end of my presentation. Thanks to listening to me today. I hope that it helps you to better understand PAD, and have a good day.